love the variety. I get to work sort of full scope of practice here within the clinic as a nurse, which is terrific, and I love dealing with people, and I see all ages and all conditions, so I love the variety. I guess that would be the biggest thing. And I like the multidisciplinary team atmosphere that I work in. You know, we have dietitian, a respiratory therapist, the physicians here, mental health therapist. It's great to have other team members to draw from.
That's a big part of primary care, is everybody working together as a team. And it's really nice to be able to go to your full scope of practice and use the skills and resources that your strong point is. You know, some of us everybody brings a different background. And that's what I think is so important about our interdisciplinary team that we have at the PCN. We're not all the same type of a practitioner, so our communication is good. We have a lot of respect, I think, amongst our peers. And I think the doctors, a lot of the times, which is such an honor as an RN for a physician to ask your opinion on something or for your input, which is great.
You know, as a nurse, I have my role, but to be able to pull in a dietitian with specific training and ability in that area for my diabetic patients is invaluable. You know, I can give them training to a certain point, but then to be able to pull in the expertise of a dietitian is wonderful. You know, the benefit to the patient is huge.
I think for the first time I really feel like I am practicing as a nurse in the sense that I'm providing a lot of education and promotion, health promotion. I'm spending a lot more one-on-one time with patients in their homes, kind of going out, and it's a very intimate kind of setting to be in a patient's home and able to see how they're living and then helping them adapt their lifestyle to make better choices, acting as resources as well. I think it really encompasses what I believe as a nurse's role. For me, it's real about health prevention and promotion.
You know, we're not waiting you know, to refer and waiting another few weeks and getting it. If we can do it all right here, right now, you know, and to be able to speak to one another live, face to face, is also, I think, a big benefit. You know, we're not always reading a written report coming back. You know, I can actually speak face to face with the physician or face to face with their dietitian or it's helpful. You know, messages don't get lost and information. Everybody is in the know as to what's going on with that patient. We all have common goals. You know, all the healthcare providers and the patient. So it's a good thing.
I think we build good relationships with our patients that I wouldn't normally have otherwise, because I have the time to spend and talk to these families. So it's kind of it's a blessing for sure, for me and for the patients and families. It's a very rewarding position to be in, for sure.